it's not always the doctor's fault. The system is set up and designed this way. If you go ask your MD or DO, how many hours of nutrition did you learn in your schooling? They're going to tell you they had one lecture. That's one of the most important pillars of your health. How is a doctor who's supposed to keep you healthy lectured for 1 hour on nutrition?
What has our community done health-wise that's been detrimental?
The Mediterranean diet is the best in the world, but we're not practicing that. It's 90% bread, 10% Mediterranean. That's not how it should be. If we were all healthy, the pharmaceutical industry wasn't, they're not profiting. If they're not profiting, they can't pay for their lobbies, they can't pay off their politicians. So yeah, right now you might feel great, but you're 50 years old, you have kids, they want to go outside, they want to play. Do you want to be inside because you can't move because you have joint pain? If you don't care, that's up to you. You got to really reflect on how do I want to feel when I'm 50 or 70 or 90.
What about mental health?
There was one time specifically in which somebody did have suicidal ideation, and we went and addressed everything. Calls me 3 weeks later, hey, I am feeling fantastic. And I think it had a lot to do with his digestion.
Or like an immigrant family that's coming here.
Exactly.
They're going to walk into the supermarket and then these apples are cheaper than these apples and they're both green. It's going to be filled with pesticides. They're not going to know that.
There's something called the dirty dozen and the clean 15. Now the dirty dozen, you should definitely try to get organic because every time they tested them, their pesticide exposure was through the roof.
Let's pull it up.
Yeah, absolutely. Let's pull it up. Number one.
That's crazy. Everything we're doing is wrong, huh? I came across the term naturopathic medicine not too long ago, and it sparked my curiosity because it was saying something along the lines of natural remedies. It wasn't consumed by like pharmaceutical companies. I'm pretty sure you guys can relate from your experiences, from your family's experiences, that there's a lot of stuff that we're doing that don't make us feel the best. And typically the mainstream solution to that is going towards pharmaceuticals. But this type of medicine doesn't do that. It makes you not feel bad in the first place, rather than waiting for you to get bad and then hitting you with the solutions. And Dr. Ahmad's very knowledgeable. He gave, you can call this an introductory 101 class on naturopathic medicine. He went over the things that we're doing right, the things that we're doing wrong, the things that we're doing too much of, and overall gave this guide to how we can live a better and healthier life. He mentions quality of life. He wants your quality of life to increase. If you're listening to this and you enjoy what you hear, the free and simple way to support this podcast is to hit the follow button, like this episode, and write down your feedback in the comments. Thank you so much for taking the time out of your day to give this a listen. And with that being said, let's get the show started.
Welcome aboard Middle East Airlines.
والمتوجهة إلى طيران الشرق الأوسط يرحب مدينة القدس العربية.
Ahmad, if someone's just tuning in right now and they're not sure whether to continue watching the episode, they're not really sure what this is about, why is it important for them to listen to this conversation?
It depends on whether they want to increase their quality of life. If you want to increase the quality of life, then you should listen. Okay. Because we're going to discuss health from my understanding. And when I discuss health, it's not just about how to treat a disease, but it's also how to prevent, right? And that includes things like diet, exercise, sleep, stress, hydration, and so on, right? Other things too, like connections, social connections. And so the point is to talk about health from a preventative perspective rather than a treatment approach, if that makes sense. So if you want to increase your quality of life, you should listen. And with the, just so you understand why you would want to increase the quality of life, right? It's so that you can live a life, to the fullest extent, right? Because obviously you see the community, a lot of people have a lot of health problems. I mean, a lot of our parents have a lot of health problems as well. And you could see they have discs, they have pain, they don't feel like doing things. They're alive, but sometimes it's inhibiting them from living. And so if you want to truly live life to the fullest, you need to be healthy. And when I say healthy, I don't just mean physically, but also spiritually and mentally as well.
Because the term healthy, and you have to exercise and you have to eat well and you have to stay hydrated, it's like we've listened to people talk to us about getting in shape and losing weight and staying hydrated, but what makes the field that you're in so much different but even more special?
Again, I think it goes back to the preventative approach, right? So naturopathic medicine, a lot of people aren't really familiar with it, with what it is. And I think it depends on who you ask. You might have a different answer. According to like the accredited federal definition, It's essentially a naturopathic doctor is a primary care physician. This does depend on the state. There's like 30 something states right now that regulate it. Michigan is not one of those. But essentially, it's a primary care physician who's trained in every modality, right? All the science, except for major surgery. So they're able to specialize just like a DO or an MD is. When you ask me, right, for me, I'm a little more holistic even than a naturopathic doctor or the naturopathic accreditation and their definition of what naturopathic medicine is. I am not just a green allopath. And what I mean by that is I'm not here to just give you a natural remedy in substitute for a pharmaceutical, right? We want to focus on the root cause. And so even though people are sort of told to exercise, they're never educated as to why, right? It's kind of like the same thing in our religion. It's like, don't do this, but like, why not do this, right? Like, why does it tell us not to do something? So I think the point is once you understand why you're doing what you're doing, you have a purpose, right? And so you have that motivating factor, if that makes sense.
It does make sense. And, it's, you'd think that it should go without saying that we need to treat the root cause of something, but now it's just reactive. So I go to the doctor, my head hurts, here's a painkiller. You just let the pain go away. So what you're saying is, rather than going to the doctor for the headache, you're going to try to prevent the headache from happening in the first place. In a sense.
Yes, exactly. But that doesn't mean that we can't give a natural remedy to help with that headache. We definitely can. But the difference, and that's what I say, like the difference between a green allopath, which is essentially like some naturopathic doctors practice. I'm not going to say, I don't want to discredit naturopathic doctors. Amazing physicians all across, specializing in every field. But there are some who essentially just act as a PCP, just using natural modalities. So never really digging in and investigating what caused that headache, right? Like for an example, right? I had a patient back in California, came in after a surgery, started having migraines, right? Migraine after migraine after migraine. So yeah, can we give her something like feverfew, which is an herb to help with the migraines? Absolutely. But why is she having those migraines is the question. Sometimes it's hormonal, right? So a woman going through menopause, but sometimes it's not hormonal and it's actually induced by toxins. So you have to try to figure out, and in this case, what was causing her migraines. It turned out to be, once she had her surgery, they pumped her with anesthesia. It was toxic for her body. She couldn't handle it. And from there on out, she was inflamed all the time, right? She had these toxins, a toxin overload for her liver. Her liver couldn't detoxify well. And so what we did, we had to do a coffee colonic in which we essentially just drained her of all her toxins. She stopped having her migraines, right? So it's not that you just look at it preventatively. Obviously, you have to try to help somebody's quality of life. So if somebody's dealing with migraines or joint pains, obviously you want to help them and reduce those symptoms, but you want to figure out why are they there in the first place. So when I say things like hydration, sleep, diet, all these different lifestyle, these health pillars, once you optimize these, right, you almost always will see positive results. Now, you mentioned something about like you go to your doctor, you have pain, they give you a painkiller, right? I don't want people to listen to this and start thinking that it's the doctor's fault, okay? Because sometimes it's not. It really isn't. Like sometimes it is, but again, sometimes it really isn't. It's their training. It's the system. If we were all healthy, the pharmaceutical industry wasn't, they're not profiting. If they're not profiting, they can't pay for their lobbies, they can't pay off their politicians. There's so many things that would then result negatively for them. So obviously their goal is not to keep us healthy, but to keep us returning. So somebody comes in for, again, pain. They're taking painkillers. And then they take painkiller. And for years and years and years, you never actually address why they have the pain. You're just silencing the symptom. One day, that fuse is just going to blow. And they're going to need either surgery or more costly medication. So either way, it's going to benefit who? The pharmaceutical industry and the medical industry, right? The doctors. But again, it's their training most of the time, and it's not the doctor themselves. So we got to clarify that from the jump so that nobody gets, feels like disrespected.
It sounds very sinister, though. No?
I would say it is. I would say it very much is. It is.
Why do you think so? Why do you think we've gotten to the state of health that we're at right now?
Like you said, it's very sinister. So why are a lot of things happening, right? I think you got to get to the root cause of that even, is like in my opinion, from, might be considered a conspiracy theorist, but it all goes back to money. Follow the money, right? JP Morgan, you know who JP Morgan is, right? Him, Rothschild, right? These are like the initial banking system moguls. Was it JP Morgan or was it Rothschild? I think it was JP Morgan. They ended up using the oil industry, processing their oil, taking the extracts from that and using that in the pharmaceutical industry. So their waste from the oil, they were using to profit even further. And so initially, they had good intention, maybe they didn't, but obviously through the last 100 years, we've obviously seen that most of the time it doesn't work, right? It just silences the symptom until, again, that fuse blows and they're experiencing a lot worse symptoms or they need surgery. Although that did. But it goes back to the money, right? And for example, I know this has nothing to do with health. Why are the U.S. politicians not saying anything about Palestine? Why are they deciding to just turn a blind eye, right? You got to follow the money. Who's the biggest lobbying group in America? NRA and APEC.
Yeah.
Who pays off these politicians, right? Pays off as in donates to their campaigns. It's the money. So I think it is very sinister. And I think it goes back to what is the benefit they get out of it, and it's money. And with the money comes what? The power. And so I know, again, I might be considered a conspiracy theorist for this, but if from my understanding and my own research, I would say follow the money and you'll understand why they're doing what they're doing.
Because you'd think that they would have started this with you said in good conscience, hey, we found this medication that will relieve you from pain. And then after a while, okay, painkillers get, they spread like wildfire. And you start making a lot of money. And then you realize oh, no, they actually don't have to take this painkiller. But now you're making too much money out of the painkiller.
You know what I just found out yesterday? Is that some pharmaceutical companies will actually pay a bonus to doctors who give out vaccinations. Now, I'm not on here to talk about vaccines, whether, I'm for them or against them in any way. But is it not suspicious that you're getting paid a bonus to provide a medication to somebody or a vaccine to somebody that may not even need that? And so it goes back to the money, right? Yeah. So they're whatever they're paying that physician for giving that vaccine, they're making more money on their vaccines, right? They're getting all that money back.
Even now with the, this isn't even a conspiracy, but with the COVID vaccine, now they're admitting it, no, it didn't do the things that they said it would. It didn't stop it from passing on from one person to the other. And they had a whole list of things that it was supposed to do. And just now they're coming and be no, not really. We're just trying it.
Exactly. And at the same time, they're also seeing all the different side effects that it had caused. Another thing, right? Now, I'm not opposed to research. I just think research is always evolving. And so if you only live by research, right, what does the research say? Then you're going to be always limited. Because in a week, in a year, in 5 years, our new research might say, everything we thought we knew is wrong. But back to my point is yesterday, I was looking at research, and it turns out that the COVID-19 vaccine has shown to increase the recurrence of herpes zoster, which is the cold sores that people are getting. And I actually had somebody come up to me and say, hey, I've been having recurring cold sores. Why do you think that is? And subhanAllah, I just came across something that showed the research showing that COVID-19 vaccinations have increased the recurrence of that. And I'm just everybody took this vaccine blindly. They had no idea what the side effects were. We don't even know, it's an mRNA vaccine. Yeah, they might have 30 years of research on it. But was it ever actually mass produced and given to the public? Do we have research on it actually in use? Not really. And so it was this propaganda campaign of, again, follow the money. Who made money off of that, right? The pharmaceutical industries, Pfizer made a lot of money on that, okay? And they gave it all across the world. And
is something like that, I'm sorry, is it reversible? You see how that lady came in and she told, and you flushed the toxins and that went away? Is there anything of that sort with
vaccines?
Yeah.
I'm not sure.
Okay.
I wouldn't, I can't tell you there is or there isn't. It's very interesting. So it's an mRNA vaccine, right? And RNA is used as a basis for DNA.
Okay.
Now, I don't know if it's as simple as 1 plus 2 equals 3. So I couldn't tell you whether it's reversible or not.
Okay.
Because it's very intricate. It's a very detailed process of creating DNA. So I don't know if there's a connection between the mRNA and your own DNA. Because if there is, I highly doubt you're going to be able to reverse that, right? But again, like the research might not show it now, but who knows what we'll see in 5 years.
Yeah. Why don't we see more naturopathic doctors?
Because why is it not legal on a federal level? Who will it affect? Again, follow the money. Who will it affect if you legalize naturopathic medicine, meaning you actually educated the mass on how to be healthy? And by healthy, I mean preventing disease.
Yeah.
Right? Who would it affect negatively? It would affect the pharmaceutical industry, right? It would negatively affect their profits. Because if somebody's healthy, they're no longer going to need to be on their medications. If they're no longer on their medications, and obviously the US is charging an arm and a leg for simple medications, right? Compared to Canada, which is why some people have to go over the border to get their medications, compared to overseas, it's going to negatively affect the profit margin of the pharmaceutical industry. Mm-hmm. And so that's why I believe we have not been regulated on a federal level, right? So now it's by state. So a lot of Western states are pro-naturopathic medicine. There's I think most of our schools are in the west side of the country. One is in Vancouver. In the east side, it's not as popular because the states have not yet regulated to the extent that Western states have. Mm. So if you go to California, almost everybody, if not everybody, is going to either know what naturopathic medicine is, or they're going to be seeing a naturopathic doctor. Here, that's not the case. And I'll give you an additional reason as to why it's not the case in Michigan. For example, my clinic. I get 2 questions asked almost daily. They call to the clinic. Number 1, do you see kids, right? And that's not even relevant in this case. But number 2 is what? Do you accept insurance? If I can't accept insurance in the state of Michigan because it's not regulated. Once they hear that, it's I can't come see you.
I have to pay
out of pocket. I can't come see you. And so it's an issue of people are in a situation in which they can't afford it, right? It's not cheap. And it's not even on me. That's not I really do try my best to meet people where they are, right? So I've given many, many clients huge discounts. Sometimes I've seen people pro bono just because I want to help them, right? That's the goal. And so I have my product business and then I have my clinic. And my clinic is truly me just trying to educate people on how to be healthy, right? And help them out because they're struggling. They need somebody. And that's why I'm back here in this community, right? That's why I came back to Dearborn.
Where were you?
I was in California.
Okay.
And my Khala Ali actually called me when I was moving. He said, look, you cannot stay there. I said, why Khala? You're going to lose sense of your religion. You're going to lose sense of your community and your culture. You need to come back when you're done. I said, Khala ala rasi, whatever you say. Now, my Khala was the closest thing I have to my jiddo, who I've never met. He's he's second oldest, but from what my mom and my uncles have told me, he's the closest thing I've had to my jiddo. And my jiddo, although I've never met him, the picture that I have of this guy is the definition of a zalame, right? And so I try to stay as close as I can to my Khala Ali because I feel like that's the closest connection I have to my jiddo. Yeah. He was a general in World War I, right? Allah yarhamu. And so this is a guy who, one of the first people who moved to the United States. I know you know the story, but I think it was in 1900 something that my jiddo moved here. So he's been through a lot. So when my Khala Ali tells me not to do something because he knows the outcome of that, yes, sir, but he explained to me, obviously. He had to explain why. And so once you understand, you're right. I don't want to lose touch with my religion. I don't want to lose touch with my culture. I don't want to lose touch with my community, right? The whole point of what I'm doing is so that I could come and bring it to my community. There's hundreds, if not thousands, of naturopathic doctors in California, but do we have many here? I know of 1, maybe 2. And most people don't even know. Right? So the point is, how do we go back to our community and help educate our community on how to be healthy? And again, that's not just physical health, but mental, physical, and spiritual health. Now, I'm not a Sayyid, I'm not a Sheikh, right? That's the role of Sayyid Muhammad Baqir or Sheikh Ahmad Hamoud. But nonetheless, there is a huge connection between all realms of health. And so I want to try to educate people on how they're connected and how to optimize those.
What has our community done health-wise that's been detrimental?
That's a great question. I'm going to have to think about that.
I'll give you an example. My family members would first at 50 think that this is the end of the road for them. and they're not supposed to go for walks. They're not supposed to exercise. Like if they go on a walk in the park at 50, that's to them like the highest level of achievement.
100%.
But to me, you look at that, and it's and other than like the heavy smoking that you see, and the reliance on medicine, and even our diet. I mean, the Mediterranean diet is the best
in the world
diet in the world so far.
We'll talk about that.
Yeah. But like I'm interested in like what are the small mistakes that we're doing on a daily that are leading us to that?
That's actually a great question. So you just mentioned Mediterranean diet is the best diet in the world. Okay, I agree. Science proves this, right? And we're from where?
The Mediterranean.
We're from the Mediterranean. So our diet should be Mediterranean based, correct? After this podcast, I want you to go online and Google the Mediterranean diet pyramid. You'll see a pyramid. It'll show you essentially the levels of the Mediterranean diet. And then I want you to go to, let's say, like a buffet. And I'll give you an example. When I went to Umrah, I was in Saudi. Saudi's where? In the Mediterranean. I go and sit down for breakfast, lunch, and dinner. They have buffet. And I'm just observing. I'm just watching. And you see, older women. You think, okay, we have Mediterranean diet here. We have the best diet in the world. You see them go to the buffet. They get 3 plates, bread, and maybe a little bit of something else. So it's like the Mediterranean diet is the best in the world. But we're not practicing that. It's 90% bread, 10% Mediterranean. That's not how it should be. So if you want to ask me what I think one of the biggest mistakes that our community is doing is the overconsumption of not just bread, but carbs as a whole, right? Carbs are the silent, I think carbs are probably the worst thing for our health. Like excessive carbs, not carbs, period. Like excessive carbs, processed carbs, high fructose corn syrup, for example. These are the things that are truly inflammatory, cause diabetes, are toxic. Truly just like overall detrimental to our health. And then you mentioned the other one, smoking. So I think those 2 things are probably the worst things that our community do right now.
Well, how bad is carbs?
So again,
excessive
carbs.
use of carbs.
Yeah, it's excessive.
What does
use
it
of
do
carbs.
to me?
Okay, so a lot of people, they think they want to lose weight, right? So what do they cut out? Fats. Like, it has fats and I don't want to get fat. No. So what happens is, right, when you consume carbs, it's the sugars that cause the release of insulin within the body, right? And insulin is the hormone that tells our body, store. We're good. We have, just store your energy. We're good. We have plenty, right? So people think it's fat, like, I consume fat, I gain fat. But no, it's truly the insulin that you want to watch out for, right? And so same thing in diabetes. People who are diabetic, they have an insulin resistance because they, whether you're born with it or you develop it later on, you have an inability to regulate insulin levels, or no matter how much insulin your body produces, you're no longer sensitive to it. So what happens is when you consume these carbs, right, you release insulin. Insulin tells the body we have plenty of energy. Let's store and put it into the cells. So it shuttles all that glucose into the cells. Now, when you do it the first time, second time, third time, whatever. Okay, but when you're doing it daily and daily and daily, you become resistant to that insulin, right? So sometimes your body has to produce so much insulin.
Resistance means it stops working.
It stops working, exactly. It doesn't work as effectively. Depends on the type of diabetes, but it doesn't work as effectively. So what happens now, your body has to produce so much insulin, right, to make up for the insensitivities, that your blood sugar levels drop too much. And then what happens? Then your body says, hey, we're going hypoglycemic. We need to release cortisol. We're in a stress, like your body's under stress. It releases cortisol. Then there's just a cycle. The cortisol tells the body, hey, it's a fight or flight situation. Have you ever heard of that term, fight or flight situation? Okay, we need to release sugar back into the bloodstream so that we have energy to either fight or run away. And then the insulin now has to be shuttled back in because now there's sugar back. And so it's this cycle. And when you're doing it consistently and exposing yourself, you start to lose sensitivity to the insulin. And so then you start to gain weight because, again, it's a storage hormone. It tells your body, hey, we have energy, start storing. You start to gain weight. With fat, you start to gain, you store toxins and fats primarily, right? You start to get fatty liver, which a lot of people in the community are suffering from. I've had many of my clients have fatty liver. Even, by the way, just so people understand, you can be skinny and still have fatty liver. You could appear skinny from the outside, but have fat around your organs on the inside. And that's the true killer, regardless of how skinny you look on the outside. So it's got to be clear. And so that's why I think carbs are so bad. And they're also inflammatory. And then they could also lead to fermentation within the gut. And then that could lead to things like small intestinal bacterial overgrowth because the bacteria now has a source that it could feed off of. And then once you have the inflammation in the gut, your cells in the gut are this tight, right? But when you have inflammation, the tight junctions start to open. And then you have bacteria toxins that start to seep through. You have undigested foods that start to seep through. And so now you have invaders within the body, correct? So you have invaders in the body, and the body's like, hey, something's like, we have people invading our body. We need to activate the immune system and take these out. Then what happens? You start to realize people, because their immune system is so overactivated, they have thyroid issues, they have other autoimmune diseases, whether it's MS or Hashimoto's thyroiditis, and their body is now attacking itself. And so, especially for autoimmune conditions, right, you want to look, how was their stress? How were their toxin? Like, are they overloaded with toxins? Are they eating something they're sensitive or allergic to that's causing that inflammation? Do they have an underlying infection that we don't know about? And once you check off each one of these boxes and you clear them, you notice great improvement, even in the worst of autoimmune conditions.
Really?
SubhanAllah.
You might start seeing this can in the grocery stores that you buy your stuff from, or from the restaurants you go eat at, or when you're pumping gas at the gas station. And it might catch your attention. You might think about this twice. Now, this can says cola, and the term cola has been associated with a few products throughout our lifetime that I can think of. And I can confidently say that if we're just speaking about taste, this is really up there. But let's put taste aside for a sec. Even though it tastes great, I need to tell you about something else. 100% of the proceeds of Palestine Drinks, the company, go straight to the people of Palestine. And maybe we're starting to get numb to numbers, but this is a whole business that is running, and 100% of their proceeds go to the people in need in Palestine. And it's all public information. They do it through the Safad Foundation. You can look it up. And you might say, yeah, but how is it a business? Like, it almost sounds too good to be true. It really takes 3 gentlemen out of Sweden that are doing well in life, that want to provide a solution, an alternative to a product that we've lived our whole lives with. And they really knocked this out of the park. Like, when I say high quality, from can to taste to feel, I really mean it. When we talk about making our community and our people stronger, it starts with creating products like this. And I said this before, I'll say it again, this is going to be the staple in our households moving forward. And with that being said, back to the episode. And that could be like what we're used to. We're used to going to the buffet and grabbing all the carbs, and we'll put like a bed of rice topped with a little bit of meat, and we'll call that our diet. And for breakfast, we'll eat eggs with a lot of bread, and that's kind of the cycle that we're in.
So people say, a little bit of butter with your bread. So we got to change that. It's a little bit of bread with your butter, right? So like the fats aren't the bad thing. It's the excessive carbs. And on bread, there's a whole bunch of things we could talk about with bread, like gluten, for example, and how the gluten in America is way higher, which is why so many people are having issues when they're eating breads, right? Versus overseas, it's a much lower percentage.
Right.
So like there's a whole rabbit hole we could go down. But yes, essentially, when you're exposed to excessive carbs, you're destroying your body, and you might not know it in the time, but trust me, a few months, couple of years, you're going to realize.
Wow. Yeah. And is it as simple as just lowering that carb intake to make it better, or no? Is there more to it?
Like, that's one way to go about it, but that's not the most effective way.
What's the most effective way?
Truly, like, it's a multifactorial approach. So not just worrying about your diet, but then comes in exercise, right? And stress control. And I'll explain both of those right now. So exercise, right? Your muscles will consume that glucose in order to produce energy in order to exercise. So if somebody just had like a heavy meal and they go and they exercise, they might feel fatigued after that, right? Because insulin is getting released on the body storage mode, relax, blah, blah, blah. But if you go to the gym after that, then you're forcing your muscles to uptake some of that glucose, and then you now decrease the blood glucose levels. So now it's in your cells because your muscles need it,
right?
So you could decrease it that way as well. There's also herbs to help decrease that. It's effective, but it's not a sustainable approach. It's not something you want to resort to. That's like something you need to if you're already there, right? But the goal is to optimize your diet and exercise. Now, stress is another factor that affects blood glucose levels. How? So remember how I talked to you about the cortisol?
Yeah.
When the cortisol is released, again, it's a fight or flight mechanism. It's like we need energy in our bloodstream so that the blood can take it to where it needs to be, which is our muscles, so we can either fight or run away. And so when people are under chronic stress and they have that chronic cortisol release, even that in and of itself can now affect your blood sugar levels.
That'll do fight or flight again. If
Fight
you're
or
really
flight.
stressed.
Yeah. So you're always in this fight. So fight or flight isn't a bad thing. It's necessary in certain instances, correct? So we should be in a balanced approach. But now we have our sympathetic this high and our parasympathetic this low. And our parasympathetic is involved in digestion, right? It's our rest and digest.
Parasympathetic is the things that happen without me consciously knowing of it.
So both of those are unconscious.
Okay.
They're part of your autonomic nervous system,
Okay.
per se. When I say like, as in you can't control it, there are some biohacks like box breathing, certain breathing mechanisms in which you can actually now physiologically bring your parasympathetic back into a balance.
Okay.
Okay. And the way that works is through the vagus nerve. I'm not sure if you ever heard of the vagus nerve. It's one of the cranial nerves that run from, so we have 12 cranial nerves. Vagus nerve is, I think, cranial nerve 10. And it kind of runs from the brain all the way down through the lungs, down through the diaphragm, specifically the diaphragm. And the diaphragm is a muscle involved in breathing.
Okay.
So if somebody's like, overly stressed, now there are cases in which you have extreme stress and you need intervention, right? For your own good, you need intervention, whether that's pharmaceutical, whether that's herbal or therapy, whatever it may be, you need intervention. But back to the point is essentially, when you do those breathing exercises, your diaphragm is now massaging that vagus nerve, and that vagus nerve activates the parasympathetic nervous system.
Okay.
So that's what I mean by like there are biohacks
Yeah.
to help to bring that back into balance.
Yes.
So yeah, those are two different parts of the autonomic nervous system in which you technically can't control per se, but now we just have this imbalance, and our
Then
goal
what's
is
the difference between
parasympathetic
Yes.
and sympathetic.
Yes.
So we have our fight or flight and rest and digest. So rest and digest should be activated when you're eating, when you're relaxed, when there's no stressors. Fight or flight should only really be activated in which you need to fight or flight,
Yeah.
right? Now we're never, like, because of the modern day stressors, like everywhere, it's everywhere. Modern day stressors are everywhere. People are overworking. People aren't getting paid enough to even live. They have to provide for their families. A lot is being asked of people now, right? And so they're overly stressed. Now what happens is you eat a meal. Let's say you're eating a meal, but you're somebody who's in an overly activated sympathetic state. Your motility, meaning the movement of your gut, isn't working properly, right? Because you're in a sympathetic activation. Your body, so like you could even look it up. Like on Google, you see a picture of what is activated with parasympathetic and what is activated with sympathetic. But when you're in a sympathetic, it inhibits the digestion. So people who eat on the go, who are stressed all the time and can't sit down and relax during a meal, they're not digesting their food properly, and their food is not moving through their gut properly.
Okay.
And what does that lead to? That leads to the fermentation of that food in the gut, or the inability to break it down. And now your body's like, hey, this is a foreign molecule, right? Once there's inflammation, remember those tight junctions open up, food seeps through, and it's not even digested. So the body's like, hey, there's a foreign body within us. We need to attack it. And you build antibodies to foods. And you're all of a sudden sensitive and allergic to foods you're consuming, basic foods.
How common does that happen?
I'm seeing it more common now, but it's not everybody. It's really not. It's not all the time. But you're starting to see a very big connection between the diet and overall health.
Yeah.
Overall health. But what else affects that diet is their stress. So when people are overly stressed, again, it doesn't work with their digestion. Right? And that the gut is everything. So one of like the best factors of understanding somebody's health is their gut microbiome. So are you familiar with the gut microbiome?
Yes.
So there's trillions of bacteria within our gut, right? And yeast, by the way, like Saccharomyces boulardii. Trillions. But when one of those overgrow, that's when you start to have issues.
Okay.
Right? There's not a diversity, and a good diversity. That's when you start to have issues.
Okay.
And when you have foods that aren't just sitting in there like sugars, or foods that are undigested that just sit in your gut and you're in a sympathetic state of mind, So your gut motility, meaning the movement of the gut, isn't working, just sitting there. So these bacteria can now feed off of this and overgrow and replicate. Make sense?
Yes.
And so it causes inflammation.
Okay. Ahmed, a lot of the things that you're saying, obviously you're very good at explaining these things, but someone might be listening and be like, okay, I'm understanding the mechanics of how everything is going and why I'm feeling bad, but I just want a solution. Like, tell me, what are steps 1, 2, and 3 that I have to do in my diet specifically to not feel bad anymore?
So I wouldn't say there's one fix for everybody.
Okay.
Like, I can't just give one recommendation that applies to everybody. Okay. I mean, there are some very common recommendations that I can make, but there are times in which some of these recommendations you should not be doing, right? So things like probiotics, right? Probiotics are somewhat effective at helping to diversify the gut microbiome that we just talked about, right? The bacteria in the gut. But actually, the most effective way to help increase the diversity is by including 20 different plant-based foods per week in your diet. Now, that sounds a lot, right? Somebody's going to be 20. What do you mean? Well, if you have stir fry, that's like 7 in one meal, right? It's as long as it's different types. So if you have an orange, that's one. And then if you have lettuce, that's another. Now, if you have orange one day, orange the next day, orange the third day, that's still one. But if you have 20 different types, what happens is that's 20 different types of plant fibers that allow the bacteria to feed off of this. So because it's so diversified, different bacteria can now feed off of this and diversify themselves.
Can I supplement those?
With probiotics.
Yeah.
Well, you could take fiber capsules, yeah.
Yeah. Okay.
Now, most fiber supplements are not going to contain 20 different types of fibers. But I'm not somebody who supports supplementation over lifestyle changes.
Okay.
Right? I always like to optimize their lifestyle changes first. So include the 20 different plant-based foods in your diet per week. Don't worry, like, you don't have to supplement. You don't have to, right? It's just another capsule you might have to take.
Right.
So if you can, ideally, just eat the 20 different plant-based foods. Now, if you can't and you're in this, like, sometimes their life circumstances don't allow them to. And so, okay, if you need to supplement, no problem, we could, you know. But again, it's always going to go back to the main point of optimizing their lifestyle habits, or their pillars of health, essentially. That's diet, exercise, hydration, etc.
You might be listening to this conversation. You might say, all right, we'll do these things that Dr. Ahmad is telling us to do, but how are we going to track it? Are you just going to start waiting until you feel better? I feel like there's a better way to conceptualize the progress that you're doing. The way I'm going to personally do it is through Whoop. Now, because Whoop is on my body 24/7, I'll be able to track how well my sleep improves, how much my heart rate variability improves, how much my recovery improves day after day if I am actually applying the things that Dr. Ahmad is telling us here. And you can do that too. Because you're a listener of this podcast, Whoop wants to give you a month for free to try it out. Start doing the things that Dr. Ahmad is telling you about and pair that with Whoop. And when you see that your body is actually improving and you're starting to feel better and you can see the proof in numbers, then I guarantee Whoop is going to start being a staple in your daily routine, just like it is mine. All you have to do is go to join.whoop.com/notfromhere to get started today. And now, back to the episode. And I think a lot of people go into these problems happen because you'll say these things, but okay, sure, sometimes I might crash, sometimes I might feel bad after I eat, but for the most part, I'm young, I'm good, I can get by, I'll sleep it off. We kind of don't see the bigger picture. Exactly. And how this might affect me when I'm 50. Even though I can see my parents and how bad their health is and stuff like that. But I can't see myself like that because I'm healthy now. But no, I won't do the things that they did, although I am subconsciously still doing the things that they're doing.
So in the beginning of this, you asked me, why would somebody want to listen? And I said, to increase your quality of life. So yeah, right now you might feel great, right? But you're 50 years old, you have kids, they want to go outside, they want to play. Do you want to be inside because you can't move because you have joint pains? Or do you want to be outside with your kids playing? These are the things you got to consider, right? Do you want to your parents are going to get older, right? You might be 50, your parents might be 90. Do you want to be able to help your parents? Or do you want to be also in the same position that they're in at 90 years old when you're at 50? These are, if you don't care, that's up to you, to each their own. You got to really reflect on, how do I want to feel when I'm 50 or 70 or 90 or 100? How do you want to feel? Do you want to be taking a bunch of medications? Do you want to live to 100 if your quality of life is not great?
Yeah.
Like these are questions you have to consider. Like if you're okay with that, do you? You know, like nobody's judging you. It's between you and yourself.
So you're saying not everyone is going to feel bad when they're older, because the thing is, someone might be smoking in their 70 and they'll be like, I've been smoking since I was 14 and now I'm 70 years old and I'm okay, you know?
Yeah. So there's a very, very, I love this quote, like a very big quote. A lot of people know it. Maybe you've heard of it. I actually posted this yesterday. Genetics load the gun, but environment pulls the trigger. Okay. And what I mean by that is that some people, their genetics are phenomenal, right? They can smoke till they're 90 and have absolutely no issues. But the majority of people aren't that way. Okay. The majority of the people, their genetics can't support them being exposed to these toxins long term and still be okay. Right. But they need to watch out now for their environment. So although their genes might make them more susceptible to certain diseases, what triggered those genes to go off is their environment, is that smoke. Does that make sense?
Yes.
Same thing. That's a very important quote people should understand. Is and this goes the opposite end too, is like, just because you're dealing with a disease, right, that doesn't defy, like, some people accept it like, this is who I am. I have this is who I am. Like, I am this disease. And it's like, hey, like, no, you got to recognize that the things that you've done have put you here, right? Like, if you ever dig into somebody's history, like, you'll find a lot of things they've either currently doing, they've done in the past that have put them where they're at, because their environment pulled the trigger.
So it's not 100% that if I'm 70 that I'm going to have major joint pain or I won't be able to walk.
Nothing's 100%. It's never going to be 100. Like, you can't I can't confirm anybody's going to get better or get worse, or this is going to happen if you continue with this. No, nothing's going to be 100%. But the likelihood is probably greater than 50% for sure.
Okay.
Right?
Okay. Because even now you hear like the research about even going to the sauna and how much that decreases Alzheimer's and these what are the diseases called?
Cardiovascular, a bunch of different cardiovascular diseases. Yes. Absolutely. Even just like, there's a lot of research showing if you go like 20 minutes 3 times a week, a lot of cardiovascular diseases, your risk goes down significantly. Absolutely. Now I'm going to give you my theory on that. I'm going to talk to you about that specifically. I think this is a very important thing, because this is another thing. A lot of people, I think statins are the number 1 prescribed drug in the world.
What is it?
I think it's statin. So these are things to lower cholesterol. I could be wrong. Don't quote me on that. But from my understanding, I think statins are the number 1 most prescribed drug in the world. Statins are there to help decrease your cholesterol. Okay. So people most doctors and people in our community, they see LDL, they consider that's bad cholesterol, right? Have you ever heard of LDL, bad cholesterol? I have. Exactly. So they look at it, LDL, bad cholesterol. Is there such thing as a cholesterol that's bad? What is it, immoral? No, absolutely not. That's not why it's bad. The reason why LDL cholesterol is considered bad cholesterol is because it's easily oxidized. Meaning, it like oxidization is essentially creating free radicals, which creates inflammation within the body. Now, when you oxidize the LDL, that's when it latches onto the blood vessel wall, right? So like people with plaques in their arteries. If you know what I'm talking about? No. So like, have you ever, like heart attacks? Yeah. What happens is there's a blockage to the heart, right? There's a blockage in one of the arteries. Okay. How did that blockage occur? It's from the oxidization of that cholesterol, right? So the cholesterol itself, it's not that it's bad. And when it becomes higher levels, it's still not that the cholesterol itself is bad. It's that now you have a higher risk of that cholesterol being oxidized.
What does oxidized mean?
So it means, again, it's like, I'm trying to think of a great way to explain this. Oxidation is essentially like, it's no longer it's not a stable molecule anymore. Okay. Right? So it's like something came in, removed some sort of atom or element from it, and it's no longer stable. Okay. Right? It's very inflammatory. And so it could react with other tissue in the body. Okay. So in this case, LDL, once it becomes oxidized, it latches onto the blood vessel wall, and then causes inflammation, and there's other things that start, like calcium. It's a cascade of events. Okay. So people have to understand. So the sauna, reducing cardiovascular disease, let's talk about what a sauna actually does. The sauna helps me sweat. When I sweat, I'm removing my toxins. When you're removing your toxins, there aren't those things that help. There's less of the factor that's oxidizing your LDL.
Okay.
Right? This is my theory on this. Like, this is from my, like, it's trying to make sense of it all.
Yeah.
But people got to understand that it's not the cholesterol that's bad. It's the things that cause the oxidization of the cholesterol that's bad. Now, you still shouldn't be looking at cholesterol levels of 300, right? You don't want that, right? Especially at a younger age. You don't want that because, again, it could easily become oxidized. So people have to understand, it goes back to what are you exposing yourself to that's allowing it to be oxidized. And number one thing is going to be smoke. A lot of people smoke, right? And that in and of itself is one of the most toxic things. And you're inhaling that. You're absorbing it, goes into your body, and this is oxidizing. Like, this is just one thing that's oxidizing that cholesterol. And you're just, not only do you have high cholesterol, especially from all the breads you're eating and the saturated fats to an extent, I have a whole theory on that as well, but you're also consuming those toxins that are oxidizing that cholesterol.
Okay.
If that makes sense.
Yeah. So really what you're saying is your eating habits are playing into it. You're not exercising, it's playing into it. Your lifestyle, like your hobbies, smoking, chilling with your friends, is playing into it. And then when you take it all together, it's just a recipe for disaster.
Exactly. Now, some people, again, genetics sold the gun, environment pulls the trigger. So some people, it just requires that one factor. That's like, they just have weak genetics. Now, it's just there's cards you're dealt. It is what it is. But you got to choose. Are you going to accept that and just say, screw it, I still want to be exposed to all these toxins and just live a very bad quality of life later on? Or do you now be like, okay, you know what? I was dealt these cards. Let's make the best of what I can with it. So it's like, how do you want to approach it? It's up to you. You got to figure it out. But again, like, some people, all they need is that one factor and their health goes down the drain.
Yeah.
But some people, you could throw at them 5-6 different ways of negatively affecting their health, and their vital force is insane. Like, they're still strong as a horse.
Yeah.
Now, again, that's usually not the case. So I don't want anybody to watch this and be like, oh, no, he's fine. Like, I'm one of those people. It's very, very rare.
It's a thin line.
It's not often that that's the case. So people have to understand that. It's most likely not the case.
Yeah.
But I have seen that. So I just want to put that out there.
I'm telling you, it's that thing where, like, I sometimes even find myself, like, falling into it. And I'll know, like, it goes a period where I know my eating habits aren't the best. And but then I feel fine. Maybe, like, I'll go work out and I'll hit the sauna and I'll feel great after. I'll be like, it's okay. I'm still young. I can kind of mess up here and there, but like, I'll still work out. But from what you're saying, it's not that never mess up, but be very conscious of what you're doing and the implications that could have on your health later on.
Exactly. So it's not, nobody's going to be perfect.
Right.
I'm a naturopathic doctor. I guarantee you, I do things that I don't recommend to anybody. Okay. I know that. Like, I sometimes indulge in foods that I should not be eating, drink sugary drinks that I probably should not be consuming. There's certain, like, engage in activities that are just affecting my dopamine. Like, I am doing things that I probably shouldn't be doing sometimes. But the point is to be aware and to limit it as much as you can, right? Because if you, like, are just like, okay, I'm young, I'm fine, and you continue to expose yourself to, like, let's just say carbs, yeah, you're going to feel great now, tomorrow, day after, but in a week, a year, 2 years, how are you going to feel then? Most likely not great. Again, it's very rare that you could put yourself under that much stress, and stress, not mental stress. There's physical stressors as well, and be fine. It's not likely. So it's about putting in the effort to the best that you can, right? And being conscious of it, so that so you're not overdoing it, right? Okay. And so, like, I have clients who come in, and like 2 days ago, I had a client come in, and she's like, "Oh, I eat my candy, but I just eat one piece." "Oh, no problem. How often?" "Every day." What? It's like, that's minimal. Like, I don't want to judge. I don't want to make you feel like you're doing something wrong, but I need to educate you. Like, hey, that is a lot. Every single day you're consuming this thing that the number one ingredient is high fructose corn syrup. So you're skyrocketing your blood sugar levels every single day. What does that do? That also affects your mental health, by the way. It causes anxiety because of that cortisol release. Right. Remember how we talked about, so that in and of itself can even affect your mental health. So indulge in it. Go for it. But, like, if you're going to eat the candy, try to eat an organic candy, an unprocessed candy, and limit it to once a week, But like, if you're going to just chase pleasures your whole life, where's that going to get you?
Yeah.
Right? Where's that going to get you?
Right. But if someone like understands that what they're doing now maybe isn't the best, they can go back. They can reverse the damage that they've done.
Oh yeah. Some people think, oh, once I hit 60, like there are older, older clients or even just people I talk to in the community who are like, oh no, I'm sick. That's it. Like no. Like go to the gym and see these 70-year-olds working out better than I am. No, I don't think once you hit a certain point, like that's it, it's over. Or even in terms of your health, that's it. Once you hit a certain point, it's over. Now there are some, instances in which that is, like if you have stage 4 cancer, you're almost at stage 5. Inshallah, that's never the case. But it's very late. It is. It's gonna be very tough to try to reverse something like that. But no, you can almost always reverse a disease. Almost. Not gonna say always, but almost always reverse a disease. You just gotta not only obviously support them, depending on how late they are in that disease. Of course, there's gonna be some intervention that's needed, sometimes even pharmaceutical, like I said earlier. But the goal is to make sure that they optimize their foundational health, right? Their pillars of health, while supporting their disease now, so that their body can heal on its own.
Okay.
Right? Because the body, subhanAllah, is capable of amazing things. I mean, like if you ever study just immunology and how the body attacks viruses and pathogens, you're like, subhanAllah, like, wow.
Yeah.
The body is capable of the most amazing things ever. You just have to support it. And it could do so much.
Okay.
Right?
Yeah.
I just got goosebumps saying that.
Yeah.
Wow.
It is fascinating. And like that's like the food, exercise, physical aspect of it. What about mental health? We talked kind of about how pharmaceutical companies try to push these medicine. Antidepressants also, very big deal. A lot of people are on antidepressant.
A lot of people.
What's your perspective on it? Like, how do you see it, and what's like kind of the preventative way? What's maybe like a natural antidepressant? Like, I don't even know where to start with the question.
Yeah, there's a whole. So when it comes to anxiety, right, there's really two types, right? There's psychogenic, meaning it's just like, it's true anxiety. I don't want to say, when I say it's in your mind, I'm not saying it's made up. I mean, it's just psychogenic, like it's just related to your psychology. But then there's organic causes of anxiety, and things like, for example, hyperthyroidism, meaning you have too much thyroid hormone. The thyroid's like a thermostat for the body, right?
Okay.
If there's too much, you're like go, metabolism's go, right? You're like jittery, you're going, your heart rate's up, tachycardia, etc. If it's too low, it's the opposite. Like that's one way.
You're more down.
You're more down, whatever. Other things are cardiovascular diseases, right? Respiratory issues. Even your gut microbiome affects your anxiety, right? So there's research, and this is research based. So if anybody does want to just go off of research alone, this is research based. The research shows that when you increase your microbiome, you now decrease your anxiety. So there's psychogenic, and then there's organic causes. By organic, it means related to some sort of dysfunction in the body, right? When it comes to organic causes, right, we can try to fix that. When it comes to psychogenic, now as a naturopathic doctor, myself personally, not all naturopathic doctors, I support them depending on how severe it is through supplements. There are herbs. There are many different herbs, and there's also nutraceuticals that you could supplement with to help support their anxiety. But I always also recommend seeing a therapist, because this is what they do, right? This is literally what they do, is they're helping you cope with your psychological stressors to reduce your anxiety.
Can I ask you this question?
Yeah.
If, let's say, someone had a little bit of the psychological, so life events are happening, they don't feel the best, but then they also have a problem with their thyroid, right? And then if the life stressor was, let's say on a scale of 1 to 10, a 2 difficulty wise, or a 3, and then there was a thyroid issue, wouldn't that make the problem jump to like a 7 or 8 or maybe 9? Like maybe just amplify that psychological issue, because okay, something happened, I don't feel well, thyroid isn't in its right shape, so now I'm even more down, and I'm associating me being down with this thing that's happening. However, if I deal with my thyroid and my thyroid is healthy, maybe I'm not feeling down anymore and I'm good. And then there's this problem that happens, and now, it's just a problem that's happening. Am I making sense?
I understand, but like, what's the question behind that? Like, what do you want to know exactly specifically?
Like,
so like, let me try to answer if I'm understanding it completely. First off, when it comes to psychological stressors, if you're at a 0, you're doing something wrong.
Yeah.
Who's at a 0 these days?
Right.
Nobody should be at a 0 in terms of their anxiety.
Absolutely.
In terms of their psychological
Yes.
stressors.
Yes.
But when it comes to, let's say they have a thyroid issue, and then that's amplifying their psychological stressors, well, the main goal is then to address the organic cause, the thyroid. Fix the thyroid while supplementing, again, so there's something called the GAT7. It's a way to gauge the severity of somebody's anxiety. Okay. So you ask them a series of questions, and then you get a score at the end, and you can understand, is it mild? Does it even exist at all? Is it mild, moderate, or severe? I've had clients come in with on every realm, right? They're mild, moderate, and I've had very severe. So once you deal with the thyroid, right, depending on where they're at on that GAT7, so like if they're severe, I'm supplementing. I need to supplement because you don't want somebody to get to a point where there's suicidal ideation, right? You need to supplement this. And in some cases, you might need to refer out for a pharmaceutical intervention, right? Which has happened a couple times. But point being, if they're severe because of this, whatever organic cause is happening, you don't just deal with that thyroid. You still need to now address also the psychological aspect of it through whatever mechanism you have to address that. So, for example, there's herbs like St. John's wort, which is essentially just a natural SSRI. You know what SSRI is?
No.
When you talk about like the pharmaceutical industry just giving out like medications for anxiety like it's candy, SSRIs are one of those.
Okay.
A lot of people are on SSRIs now.
Okay.
Now, St. John's wort is essentially like a natural SSRI. That doesn't make it safe for you to just consume, right? Just because it's natural does not mean you can now just consume this.
Is it addictive?
It's not that it's addictive, but it could put you at risk for serotonin syndrome, right? So like you have people who are on SSRIs, might not even tell you they just want something natural to help with their anxiety. They need it. Let's say they're severe on the GAT7. You want to consider like, this is, if they're severe, you might want to consider St. John's wort. But if they never told me they're also on a medication for it, then they're at risk for serotonin syndrome, and that could actually kill them. Oof. And so like, this is why it needs to be understood that you should not just go on your own and take some herbs, right? Just because it's a natural modality to affect, to addressing your stress.
People think that? Because it's natural.
It's natural, it's safe. I'm good. I can just take it.
Yeah.
And it's like, no, that is not the case. You need to be very careful. There are some herbs, even some teas that you could consume, you'll be super okay, right? Most of the time. Almost never will you have a reaction. Like chamomile tea, very mild. It does help reduce anxiety. Very mild. You should be fine. Most of the time it's not going to interact with any medications. But then when you start going up the ladder, valerian, passion flower, St. John's wort, a lemon balm maybe. I would say lemon balm is a little more mild too. But point is, once you go up the ladder, you need to now be very careful. Like you can't just consume these things because they're natural. You need to be very careful as to what you're taking. And that's why you should have like a physician on board to tell you, hey, what are your medications? What's your medical history? Figure out the severity of their anxiety and decide what is the most effective way to approach it, right? So I think back to your question essentially is if they have an organic cause and then they have psychological, and their psychological was only at a 3, but because of the organic cause, it's now at a severe rating, you still need to address that psychological cause, the psychological severity, right? By reducing that through whatever intervention, whether it's natural or in some cases even pharmaceutical. But simultaneously, you need to also address that thyroid issue.
How do I know if I have a thyroid issue?
There's labs.
Okay.
So like there's TSH. Now, I know we're going to get into like a little bit more detail. I'm getting into a little bit more detail, so I apologize for this.
No, it's okay.
But some people only check TSH, and sometimes TSH is off by a little bit.
And that's the thyroid hormone, TSH?
So the TSH is a hormone that tells that it's so there's a 3-part. So it goes TRH, TSH, and T3 and T4. T3 and T4 are the actual hormones that your thyroid releases. Okay. Right? Or that that affect the thyroid gland. TRH is thyroid receptor hormone, meaning telling you to produce this, right? So it's a negative feedback. If you have high T3 or T4, it then decreases TSH. Tells TSH go down, so you're not stimulating so much thyroid hormone. We have too much. Right. So it's that. So some people, they look at TSH, it's a little bit off, like, you're fine, but they never check T3 or T4. T3 being the active hormone. It's like, why are people not checking free? Like a lot of physicians, I have clients like, hey, can you go back to your doctor, because insurance will cover it.
Right.
With me, insurance won't cover it. Go back to your doctor and tell them I am requesting a free T3. Oh, okay, no problem. And I've had people come back and say, yeah, they won't order it. It's like, do you just want to pay out of pocket? Like, what do you want to do here? And it sucks. Like, I don't want to put them in that position, but their doctors won't do it. So the point is, I know it's crazy, but the point is, back to the question, is address that issue if there is an issue, and you could tell through labs, while simultaneously supporting them depending on the severity of their anxiety.
Like, maybe my question was more like, if someone came to me and I see that they're always down, their every single problem that they go into, it just puts them into this, like, between quotations, depression. Maybe it's better advice for that person, like, hey, can you go get your thyroid checked out, and get that thyroid checked out, and then after it, maybe you can start talking about therapy. You can talk about that stuff. But why don't we just deal with our thyroid first, make sure that the thyroid is healthy and that's it's not affecting us like that, and then we'll see, okay, now what's wrong with you?
Absolutely. So 2 things to that. One being, I don't think that you should address the thyroid first if they're at a severe, severity of like 15 on the GAT-7 or even 19 on the GAT-7.
Okay.
Because then you're putting them at risk. Like psychologically, again, they could be suicidal ideation at that point. They're dealing with so much they can't handle it anymore. So you don't want to just address in that case like the thyroid. You still need to support them simultaneously, meaning at the same time you're doing both. Second part to that is, if you're a good physician, you should be trying to figure out what's causing that anxiety. Is it organic or is it just psychological? Right? If you're just like, hey, you're coming in, you have anxiety, here's an SSRI, like, where's your role as a physician? What did you do? Like, what did you really do to help this patient? All other than just give them something like, it could be thyroid related, it could be cardiovascular related, and you never even looked into it. You just said, hey, you have anxiety, here's an SSRI, but you never fixed the cause. And so that's the most important thing about naturopathic doctors, is they look for the cause. Now, there's also non-naturopathic, functional medicine, NDs or MDs or DOs, it doesn't matter what kind of doctor you are. Although the training in traditional allopathic system isn't as, it's not as rigorous in telling you to figure out the root cause, there are doctors who are fantastic and go out of their way to figure out what the root cause is. MDs, I'm talking about medical doctors, even DOs, they go out of their way. And that's what I want people to understand, is you can do that. You don't have to follow the system. And again, I started off this conversation by telling you it's not always the doctor's fault. The system is set up and designed this way, right? They're taught this way. Like, if you go ask your MD or DO, how many hours of nutrition did you learn in your schooling? They're going to tell you they had one lecture. Not a class, one lecture on nutrition. That's one of the most important pillars of your health. How is a doctor who's supposed to keep you healthy lectured for 1 hour on nutrition? Again, it goes back to the system, right? So my point is that some of these doctors, if they're truly great physicians or they want to be great physicians, you have to try to dig into what caused it. So that's the most important fact. Find yourself a doctor who is going to go out of their way to figure out the root cause.
What's the root cause of you going into naturopathic medicine?
It's like, how did I find naturopathic medicine?
Yeah.
How I got into it.
Like, why would you go that route? It seems like, from what you're saying, it's an uphill battle,
It is.
You're up against very large corporations with tons of money and tons of power that you've already mentioned before. And you're now in a state where, okay, no insurance. People have to pay out of pocket, which a lot of people don't want to do. It's almost, if you're thinking about it from a career perspective, it's like, why even bother with this type of stuff?
It's tiring.
It's very tiring.
It's very
it feels
tiring.
like.
Although they have all their money and their corporations and whatever else they have, I look at it as like, I have God. And if I have God, who's going to stop it? Nobody. No matter what, you're not going to stop it. And the reason why I so strongly believe I have God on my side in this, he created these herbs. Who created them? Not us. He created them in their most perfect form. SubhanAllah, right? Like there's herbs for so many different diseases, right? There's diet, like there's just basic foundational health that the Prophet has preached, that our Imams have preached. Like we are supposed to look at health as a holistic perspective, right? Now, again, pharmaceuticals are needed in some instances, but I needed to, to answer your question, I grew up wanting to be a doctor. But the question is, I'll go to my doctor. Are they healing me? Not really. They were never truly healing me. It was just medication after medication after medication. Now, alhamdulillah, I wasn't somebody who grew up with like this very severe disease who had to look into finding a cure for myself or anything like that. There are cases like that. But I was just very observant. I was looking around and just watching, and like people very close to me who did deal with certain diseases, and they're just stuck in the system. And they go to doctor after doctor after doctor, and 30 years later, hey, how do you feel? Awful. Absolutely awful. So then I realized, this was around, I would say, my freshman year of undergrad. So this is the first year I ever moved out of my house. Okay. This is when I now lived on my own. I had a roommate, but point is, like, I needed to feed myself, right? I needed to worry about my own health. I decided what goes into my body. My mom was a cook. I was in East Lansing. Everything was my own decision.
Yeah.
So in addition to that, I was also like, there was just this weird shift in me understanding energies, right? Like just looking at energies, like positive energy, negative energy, like auras. I know it's getting a little bit voodoo, but like the point is, I was just getting into energies, like what are like good, bad, evil, like, and it started to connect. Like it just, all these dots just started to connect themselves in terms of my like, even at the same time, by the way, this is like, while I'm trying to figure out these energies, I'm starting to understand my religion more. I felt closer to my religion. Interesting. Very interesting. And it's like, okay, fine, all this is happening, and then one day, I get sick. And this is still, again, I'm going to school because I want to be a doctor. I get sick. Medicine didn't help. It didn't help. Nothing helped me. My mom goes, hey, how you feeling? Like, oh, mom, wallah, I'm not feeling great. Okay, I want you to go to the cafeteria. I want you to grab lemon, honey, and kiwi.
Okay.
Kiwi. No, yeah, my mom's big on kiwi. She loves the kiwi. And she's like, I want you to go do this. I'm like, okay, I go to the cafeteria. I do what she told me to do. I swear to God, it was within hours. The next day, I was perfect. But within hours, I'm feeling better. SubhanAllah, like, this stuff works. So at the same time of me starting to get close to my religion and understanding energies and what's good for me and what's bad for me, I'm like, this isn't like, doctors aren't truly healing people. Like it didn't feel right. I was like, I don't want to go into a system in which I feel like I'm contributing to a negative outcome in health, right? And I didn't know what naturopathic medicine was at this time at all. But then it started off with me just starting to be aware of my own health. So then I got into organic foods, right? It's just like baby steps of getting into this like field of true health, like organic foods and understanding why organic foods. And if you don't know, it's like, for one, GMOs, for two, pesticides, which can actually disrupt not only hormones, but your mitochondria. So your mitochondria are the powerhouse of the cells that produce energy. And so if you're disrupting that, you're fatigued, you have brain fog, you don't have energy.
So you might eat a vegetable and feel like
but you
tired.
eat a vegetable filled with pesticides that are literally disrupting your body from producing energy.
Okay.
Right? Like glyphosate, that's one of the biggest mitochondrial disruptors, right? And it's in almost everything now. And so people, like, once you become educated, and again, that's my point, is to tell people why they're doing what they're doing.
That's crazy. Everything we're doing is wrong, huh?
Not everything, and it's
Most
nobody's fault, but a lot of things.
Yeah, but I mean, we don't know that if it's filled with pesticides.
So
first, how would my mom know that this is filled with pesticides? Or like an immigrant family that's coming here and they just see that these apples are cheaper than these apples. That's what it really comes down to.
Exactly.
You're going to walk into the supermarket and then these apples are cheaper than these apples and they're both green and they're going to grab this. It's going to be filled with pesticides. They're not going to know that, Exactly. And you can't, of course you can't blame them, but it's like you're stuck in this cycle where it's an uphill battle.
I know. But so like, they're not aware, right? They're not aware. And so the goal is to educate. But further than that, there are times in which, Well, by the way, to answer your question just simply is like organic foods, for the most part, have way less pesticide exposure. Sometimes they have none, but even though they're not supposed to have any, it gets on there. It happens, right? It's not perfect. So, be aware of that. But it's still going to be less and better than the non-organic. Now, you got to not just be oblivious to the fact that some people can't afford it, right? Some people can't afford organic everything. So there's something called the Dirty Dozen and the Clean 15. So these are just like there's a company or organization, EWG, and what they did is essentially they tested these different fruits and vegetables to see the pesticide levels in them. Okay. And so they came up with the Clean 15 and the Dirty Dozen. Now the Clean 15 means that you don't have to buy these organic because their exposure to pesticides was way less, right? So if you can't afford organic, that's fine. It's okay. You'll be okay, inshallah. Just get these Clean 15 non-organic if you have to. Now the Dirty Dozen, you should definitely try to get organic because every time they tested them, their pesticide exposure was through the roof.
Do we have them? Do we know what they are?
Yeah. There's a list.
Can we name them to people?
Yeah, I could pull them up.
Let's pull them up.
Yeah, absolutely. Let's pull it up. We're going to do the 2024 Clean 15, okay? So number one is, meaning Clean 15, meaning you don't have to get these organic if you can't afford it. Don't worry about it. So sweet corn, pineapple, onions, papaya, sweet peas, asparagus, honeydew melon, kiwi, cabbage, mushrooms, mangoes, sweet potatoes, watermelon, and carrots.
I don't have to get organic.
You don't have to.
Okay.
Again, I still
You would recommend?
I'd recommend it because then you're
If
still
you can.
If you can, exactly.
What's the Dirty Dozen?
Let's pull up the Dirty Dozen now. So Dirty Dozen. Okay. Number 1, strawberries. 2, spinach, kale, grapes, peaches, pears, nectarines, apples, bell and hot peppers, cherries, blueberries, and green beans. Yeah. And these are common foods, right? These
are the most common. They're more common than
exactly. They're very
list.
common foods. So these are the ones you should be getting organic.
Oh, we're in trouble.
Yeah.
Yeah.
We're not. There's a way out.
Yeah.
There's a way out.
You talked about people with suicidal ideation. I'm just curious. Have you came across people with suicidal ideation at your clinic?
Not too much, really. I would say it's actually more so outside of my clinic and talking to people, like people who've requested help but not in the clinical setting. And so I've had to try to help them away from my clinic.
Why would they recommend that?
Like, why would they want to not be in the clinic? It's just like whatever reason. Maybe sometimes I was close to these people. And so like they don't like, they're just like, hey, can you help me out? I'm like, yeah, I'll say no problem. So like I'll call them, or I've even done this when I was in California, right? Like I've had to talk to people from Michigan, can't see them in the clinic. I didn't even have a clinic at the time. There were times in which people had suicidal ideation. There was one time specifically in which somebody did have suicidal ideation, and I had to really consider, do I want to refer them out? Do I want to refer them out for pharmaceutical intervention? But the problem is, once they're on that pharmaceutical intervention, it's very hard for one to get off of that later on, right? But for two, to even have a physician that prescribed it in the first place who's willing to work on a plan to get you off of it. So it's like I had to consider, like, I know he has some suicidal ideation, but like, do I want to now refer him out and get him on, in a position in which he might be on a drug for a very long time, if not the rest of his life? So in that case, I decided not to. I don't know what pushed me not to. I just decided, I was like, I think I got this. And we went and addressed everything. I mean, this was a very tough wellness plan. Like it was very intricate. I addressed every pillar of health, all the herbs that were necessary for his mental health, everything. Calls me 3 weeks later. Hey, I am feeling fantastic. Feeling great.
3 weeks.
3 weeks.
Wow.
I was like, wow. Alhamdulillah. I mean, this is somebody who was dealing with suicide ideation.
Yeah.
And so it's like,
it's not easy.
It's not easy. It's not. And that's what
3
I'm saying.
weeks is a good amount of time.
Yeah, it is.
It's a very relatable amount of time.
Yeah. Like 3 weeks, like I'm feeling great. But in that case, like in his case, I think it was more organic cause. I think we fixed the organic cause, and I think it had a lot to do with his digestion. We fixed the organic cause, and that led to a reduction of his anxiety symptoms, his anxiety, period.
Wow.
Yeah. So that's what I'm saying. Like, depends on, there's no one cure for everybody. every single person they have to have their individualized plan and what works for them, whether it's financial, whether it's time, whether it's a different cause, whatever it may be. There's not one recommendation you can make for everybody. I wish it would be so easy.
Yeah.
Like imagine I could tell everybody, hey, do this, you're good, everybody be healthy. That's not the case.
Yeah.
You have to take somebody's case, you have to get their specific history, and you have to figure out what is best for them.
Okay.
Yeah.
Ahmed, do you think people nowadays have difficulty handling pain, and that's part of reason why, like a reason why this is happening? And I'll give you an example. We were talking about cocomelon, right, before we started.
Yeah.
And like the quick, like everything's quick, everything is fast, everything is instant gratification.
Oh,
even with
instant gratification.
Yeah, even like with
Big
when it came to medicine, like I'll have friends that if they have like the slightest headache, they'll rush, grab as many pills as they
Ibuprofen
can,
or whatever it is. Yeah.
They start popping them all day until they don't want that pain to be there in 5 minutes. Now, I'm from the camp, and I understand people, I mean, some people do that. I'm from the camp that if my head's hurting, let me just wait it out. I'm not trying to take a pill to stop it right now. Obviously, if it's severe, then you do. But it's a pattern. Even my sister just gave birth, and thank you. She was at the hospital, and she was telling me that the nurse, I forgot what was hurting, but the nurse came and told her, like, hey, let me get you medicine. She was like, no, like I'm good. I'll just like wait this out and see what happens. But the nurse was adamant. She was like, no, but like we can get you medicine, really. And she was like no, like I don't want medicine. Like, okay, it hurts, but I mean I can handle the pain a little bit. But it goes back to the system and what we're used to now. Like, okay, you're in pain. Khalas, 5 minutes. I don't want this pain to be here.
So, that nurse most likely didn't have ill intention, right?
No,
like
course.
she probably just wanted your sister to feel great.
Right.
But again, it goes back to the system. It's like, oh, they have the symptom, great. Like this is the medication for it. Like that's how they look at it. It's symptom, medication. Medication don't work, surgery, right? That's like it's just like this trio. That's it. Symptom, medication, surgery. That's it.
Yeah.
But I think, again, it goes back, like you said, to the severity. Now, I'm not going to say never give that medication or never perform surgery. It goes back to the severity. So, like, if your sister was feeling severe pain and it was excruciating and she couldn't handle it anymore, give her medication and then try to figure out what's causing it.
Yeah.
Right? Put her out of that misery. Like, you don't want her to be suffering.
Of course.
But it becomes so easy. It becomes like, oh, I can just take this. So instant gratification is something you just mentioned, which is a huge topic, and I really consider this the modern day like drug epidemic. And it's not even through drugs. It's truly through just this. It's a westernized civilization. It's very interesting.
Yeah.
Like it's in more so in the West. Like you'll notice people need to be satisfied immediately, right? Social media, right? Foods. Sugar, by the way, does this. Sugar skyrocket, like simple sugars. If you oversaturate your body with sugars, skyrockets your dopamine levels.
Right.
I don't even know if you feel great anymore. I'm starting to like doubt this understanding of dopamine being your feel good chemical. Like I don't even think that's the case anymore. I think it's more like a numbing chemical. If you really like if you notice, what does social media scrolling do?
Yeah.
Right.
It just numbs you out to what's happening outside.
It like
of
numbs
that.
you out, but it's supposed to be releasing dopamine. That's like the reason why it's so addictive.
Mm-hmm.
Colors, same thing. Like these things, they start to release your dopamine, and it's supposed to be feel good chemical.
Right.
But if you notice, like, do these people actually feel good? No. You start like it's just instant gratification. They just need to feel numb again.
Yeah.
They need to just be like gone, like not even there, not present anymore. They need to just feel numb.
Yeah. It's an escape.
It's an escape. It really is an escape. And I myself am still trying to figure out how do we address this issue. Like I don't know yet. Like obviously the way to address it is going to be to stop engaging in the things that cause it. Right, causes this lifestyle of instant gratification, and that includes trying to remove like. Same way we said that if you have zero anxiety, like something's wrong, like it's a part of life to feel, times of depression. It's a part of life to feel pain, right? Falling down and getting up. Like these are a part of making you a human being, right? You should grow through these experiences. But if you just numb yourself all the time and you're just looking for a quick relief, like you're gonna wake up one day and be like, what happened to my life? Like time is flying. Like there's no more life. Like what happened? The last 70 years are gone.
Yeah.
And what are you gonna do at that point? So if you're just numb for your whole life through like just chasing this craving of dopamine, you're one day gonna wake up, right? And inshallah, one day you'll wake up and you're gonna be like, what just happened? Like time just, my life just
flew by.
It flew by. And it's like, you ever watched that movie Click?
No.
You remember Adam Sandler with the remote?
Mm-mm.
So there's a movie, Adam Sandler had this fast forward remote.
Okay.
Anytime he didn't want to do something, forward. He didn't want to deal with his wife yelling at him, forward. He didn't want to deal, whatever it may, forward. Soon enough, he's 80 years old. He looks, he's like, what just happened? My life is gone. It's the same thing. This instant gratification. It's just like chasing it, relieving your satisfaction now, and just repeat for your whole life. You're just stuck in this cycle of numbness, of like not even being present, not experiencing life. It's a simple fix. And
even with the pains, you're saying, experience them.
Experience, like depending on the severity. Like
we're not talking about severe pain.
Yeah, and depending on the cause of that pain as well. Like, of course, if somebody fell, and you have a little bit of pain, deal with it. It's okay. Like, you don't have to go take a medication. It's super severe. You have hemorrhage, whatever it may be. Obviously, go get it checked out. Do whatever intervention is necessary. Again, it depends on the case. There's no one answer for everything, but I do think that people just like simple, easy fixes, and they're just chasing this dopamine crave of like instant gratification. This is instant gratification, by the way. Like, that's like dopamine release is a part of the science behind instant gratification. And it's like, experience life.
Yeah.
Like, it's okay. Well, it's okay. Yeah. Just experience it. Because with the ups come the downs, and with the downs come the up.
You're absolutely right.
And it's like, don't you want to experience the whole life as a roller coaster? Or do you just want to be numb and just be here your whole entire life? You know what I mean?
Yeah. What's one thing that we didn't talk about today that you think we should have?
The connection between Islam and science.
Go for it.
Okay. So, you ever hear church and state?
Yeah.
They're separate. A lot of people look at it like it's separate. But why do people look at it like it's separate? Since when has science disproved anything religion has ever said? In fact, it's only proven the things that religion has ever said.
Yeah.
I'll give you examples. And another thing, by the way, Islam, the connection between Islam and science, and by science I mean like medicine, really, and like health. When the Quran tells us not to do things, okay, people have this is a problem within our community, by the way, especially within our community here in the West, is people tend to look at our religion almost like a rule book, like it's do's and don'ts. I think, from my understanding, it's 3% of the Quran tells you not to do things.
Yes.
Something very minimal. It's very minimal, yeah. Like telling you rules of do's and don'ts.
Right.
But for some reason, we're taught this is how you should, like, this is what you do or don't do. You drink alcohol, you go to hell, right? Like, this is like, it's not that simple. Like, the Quran is a way of life, right? And so when the Quran tells us to do something, right, or not to do something, like, for example, not drinking alcohol, people think it's like, some people think it might just be on a physical level. But I don't think the Quran tells us to do anything for one reason.
Right, of course.
I think it's always going to affect every realm of health, and that means mental, physical, and spiritual.
Okay.
So alcohol, for example, mentally, what has it shown to do? It could increase risk of depression. Physically, disrupts your gut microbiome, increases fatty liver, increases inflammation, puts you at risk for so many other diseases, right? And spiritually, I mean, the Quran tells us not to do it for a reason, right? It brings us farther. It takes us farther from our Creator, and in that case, you have a lack of fulfillment, right? A lack of confidence, a lack of security, a lack of happiness and peace. Most importantly, peace, right? And so there's a huge connection between our religion and our science. And I was actually watching Hajj Hassanin. You know Hajj Hassanin?
Of course.
He had, very interesting, he actually presented a lecture. SubhanAllah, I don't know how I came across this yesterday. Crazy timing. But he presented a lecture in San Diego, which is where I went to school, by the way. I wish he did this when I was there. I had no access to any of these scholars when I was in San Diego. But I was listening to this lecture, and he said something very interesting. Science is a subset of religion, not the other way around, right? So science is a tool that God has given us, right? And we could spend our whole lives trying to figure out the science. But we should never separate the two. Rather, we're using science to the benefit of Islam and understanding our religion, right? And understanding why God tells us to or not to do something. Because the Quran is a way of life. And if you follow it, you're not just physically great, but you're also mentally and spiritually great.
Right.
And the whole goal, behind me trying to educate our community on health is to create strength, right? When you're healthy, you're strong, right? You're strong mentally, you're strong physically, and you're strong spiritually. And when you're strong, who can stop you? Truly. And so I really think our community has the most talented, most amazing people in the entire world all here. We're just not united. Once we unite and we're strong, and to be strong, we need to be healthy, we will be unstoppable. We will create change in this entire world that people will look at and be like, how did that even happen? Like, it'll be a ripple effect. I truly believe that. And so the goal is not to just educate people on just their physical health, like I mentioned earlier, but mentally and spiritually as well. So we could be holistically strong and healthy to use our strength to bring peace throughout the world.
And they go hand in hand.
They go hand in hand. They always will, always have. And I have somebody try to bring up a claim in which they don't.
Yeah.
They can't.
Yeah.
Alhamdulillah.
It's been a great conversation. This is definitely not the last time you mentioned that it's just education on education on education. And what have we been talking for, like almost an hour 30?
Wow.
It's
that flew,
right.
flew.
I thought those were like 10 minutes.
That was like, that flew by.
Right. You're not going to be able to give all the information needed for all of us to live that life where we're not as dependent on the people with money and power that are hungry for that, right? So this will be probably a series of episodes that we do all the time.
I would love to be back, inshallah.
All right.
Thank you for having me.
We'll do it.
Allah,
for sure.
Thank you for having me.
Habib.
Inshallah.